Well, good afternoon, everybody. It's lovely seeing everybody here. I think we're going to have a good session. Let's make sure it's interactive and should be interesting. I'm very happy to see everybody, and I want us to be like a family of people sort of on the same journey, and that's exactly what we're on. We're basically here to help you, equip you with skills, and ensure that we give you some sort of helpful advice today on chronic pain and how it affects certain sort of psychological issues in your life. So my name is Dr. Francois Lowe. I am one of the interventional pain doctors, and I'm very happy to sort of work with Ellen McNaughton, who is a counselor and also has done some counseling, some psychology as well. And, of course, Madeleine Eames, who is also a counselor and she's got a master's of social work. So it's wonderful to have them. And I think this program is just restarting, and it's going to go from strength to strength again. So let me just sort of tell you sort of a quick little story about a patient who actually was in your position with chronic pain and really had nowhere to go, and it's a patient with a paraplegia as a result of a spinal cord injury, and he was doing really poorly. Was not coping with pain at home. He had panic attacks, had to drive to the ER and sit outside of the ER because he just couldn't stand his pain at home, and he didn't know what to do with these emotions. He was angry, he was frustrated. He had a lot of built up sort of, anxiety and panic, and, saw multiple physicians. Nobody really sort of equipped him with the skills he needed. This was not a medication thing that he needed. He sort of needed that compassion, the skills to deal with these symptoms. So he's seen a psychologist, he's worked with a team, and he's had some interventional pain treatments done. And he now understands where his anger and his frustration is coming from. It's sort of the loss of autonomy, and so he understands that process better. And he knows that his pain is not just a spinal cord issue. It's not just pain in the spinal cord and the legs. It's also sort of a deeper issue with coping and having difficulty adjusting to his new environment. And he's now doing fine. His pain is under control. He's on appropriate medications, seeing a counselor on a bi-weekly basis. So things have spiraled back from the abyss. So that's the good news here. So the plan here is to talk about all the options with regards to specifically anxiety today and also anger. And we'll understand in a minute that anger is not always a bad emotion. It's often an emotion that sort of gets things going. If you can channel that anger and channel the frustration that you're dealing with, because I think we all know how frustrating it can be. So any questions at this point in time about the program? This is the second time you've been here, is that correct? For most people? Great. So I'm one of the 9 doctors there at the pain clinic. We love helping people like you. It's our passion. But we also know that this is an interdisciplinary process. We can't fix it all at the point of a needle. We need some help from other enlightened colleagues to deal with all these other very important factors to decrease the central sensitization, this increased pain centrally in the brain and spinal cord. That's so important to deal with as well. So yes, without further ado then, I'm going to hand the floor over to Mary Ellen, who's going to talk about the first part. Thank you. It's probably a good idea to give this to you.
I'll try it. I don't know if it's going to continue to work for me, but give it a shot.
Okie dokie.
Okay. Can you hear me? Yes? Great. Thank you. Okay, so we call this course 1 Degree Course Correction. And the reason we put that name is because we really want to focus on not overwhelming you, not giving you too much information, and really encouraging you to really trust yourself. We're going to invite you to take a look at a lot of different ways of looking at things, but at the end of the day, you need to trust yourself. You need to take what resonates, what feels like it fits for you, and the rest of it, just leave it at the door. So just to reiterate, we're not telling you that you have to do anything or there's anything that's going to be that magic thing. However, what we do present has had really good results for some people, and it could be helpful for you as well. So my name is Ellen McNaughton. This is Madeleine Eames. And today we're going to talk about difficult emotions that arise when we have chronic pain and learning how to get support. So we're going to have tools to basically understand how to get support. And we often think of getting support outside of ourselves, but we're actually going to be talking about ways that we can also support ourselves and look at ways to calm the nervous system and just cope. So last week, we talked about how many needs are not met when you have chronic pain. And I'm sure that most of you can relate. Almost every aspect of your life is impacted. A lot of people have their employment impacted, so their very survival is impacted. But certainly relationships, your ability to exercise, to have even your ability to sleep and to get relaxation can be compromised when you're in chronic pain. And all of those things lead to a sense of loss. And last week we talked about grief and what grief was and how grief is the organism's automatic response to loss. So grief is a result of loss, but mourning is the expression. And grief is not just one feeling. It's not just sadness. Grief is all kinds of emotions. It's anger, it's frustration, it's loneliness, it's disappointment, but it's also thinking. Things like, what am I going to do? How is this going to end? What's going to happen to me? Those are thoughts, but they're part of grief. And interestingly enough, it's important for you to be able to express that. And as you probably all have experienced, sometimes it doesn't feel like there's space to express that. But the best way for that expression that morning is to have a compassionate witness, to have someone who is really willing to hear and receive your expression. So again, last time we talked about imagining this entire course as framed with a frame of needs, because I'm always going to go back to learning how to recognize what needs we have and how to meet the needs that we have. And so all of you have a yellow sheet in front of you, and you'll notice on one side it looks like this. And there's different sections, and sometimes the words appear more than once because sometimes different needs are in more than one section. So we're going to be using this for a process that we're going to do in a little bit, just for you to notice it. But in any given moment, how do we know? How do we know what our needs are and whether they're being met or not? How do we figure that out? And I'm going to invite you to entertain the idea that feelings are actually the doorway in. Feelings are like a signpost that point you in the direction of your needs. And on the other side of that yellow sheet, you'll notice feelings. And what you'll notice is that feelings on the top of the sheet are feelings that point you in the direction of needs that are not met. So uncomfortable feelings let us know when our needs are not being met. And at the bottom are feelings that let us know when our needs are met. Those are the kind of feelings that let us know, oh, there's a need being met here. So feelings point us to needs, and feelings are like the signpost. However, and this, again, I'm sure you already know, feelings are not always encouraged, the expression of feelings. So to express upbeat, happy feelings, that often is encouraged. Can you relate to that? People are happy for you to express happy feelings, positive feelings, celebration. Yeah? But uncomfortable feelings are often not encouraged. So has anybody had the experience of needing to express uncomfortable feelings, negative feelings, and feeling like they're not really welcome? Yeah? Yeah. So anger. Anger is one of those feelings that often, not only is it not welcome, often people are afraid of it. Often people have had a lot of really negative experience with anger, and so it's a feeling that's almost taboo in a way. That it's definitely not encouraged. Yet, it's a really common feeling to have in a lot of different situations. It can be triggered by many things, and it certainly is common when you're experiencing pain. Anger is actually one of the most valuable emotions that we have, but it's also one of the most misunderstood. And so I'd like to talk a little bit more about, yes, you can relate to that. I'm going to recommend, this is a book, you can get it online. The author is Marshall Rosenberg. He's also written the book that's up here called Nonviolent Communication. But in this book, he speaks specifically about anger and the surprising purpose of anger. And I'm just going to give you a very quick synopsis of how he talks about anger in this book. And so if you don't need to take notes if you want to go back to it. It's actually in this book. So why is anger so valuable? The reason is it's a cover emotion for more vulnerable feelings. So feelings like grief, which we talked about last week, fear, sadness, confusion, helplessness, hopelessness, really vulnerable feelings that are actually much tougher to express because it doesn't feel safe to express those feelings. Interestingly, Marshall Rosenberg will tell us that frustration is not the same as anger. Frustration is that energy. You know when the drawer won't open? It's like, this drawer won't open? That's frustration. Anger is when you decide why it won't open. When you start thinking. So anger is an emotion, but it has a thinking process involved with it. Marshall talks about anger in the context of 3 other feelings. He calls them the 4 friends. So anger is one on the one side, and on the other side is guilt, shame, and depression. And what he will say about these 4 emotions is that they're emotion, but they have a thinking process connected with them, involved with them. So they're thinking plus cognition. But the thinking is a specific type of thinking. It's a type of thinking that's actually quite toxic, and it's a type of thinking that is very common, and that thinking is blame. So with anger, blame is out towards other people, but with guilt, shame, and depression, blame is in towards yourself. Yes? That's a perfect lead into where we're going, because I'm going to give you a process to help you to deal with exactly that, because our anger gets triggered, and sometimes it gets triggered without us even really having an awareness of connection to it. And so I'm going to help you yeah. Mm-hmm. Yeah, you got triggered. Okay, you hold tight and you'll see that what I'm going to be talking about is exactly going to address what you're asking. Okay? Okay, so anger is a feeling. It has thinking process involved with it. That thinking is blame. With anger, blame is out. And with guilt, shame, and depression, which are kind of progressive sometimes, the blame is in towards yourself. Now, the thing that often people don't understand about anger and guilt is that it's not common, it's very uncommon for one to exist without the other. That if you feel angry on some level, you probably also feel guilty. Now, the thing about guilt is a very yucky feeling, and people often don't stay there very, very long. And sometimes anger feels like a safer place to be. but it's very, very common that both are together. They're almost like a two-headed beast. And the analogy I'd like to use is a ping pong table, because you can go back and forth between anger and guilt, anger, guilt. In 30 seconds, you can go back like 60 times. And the operant word is the word should. It's that, oh, you should have, well, but, you know, I should have, but you should have. And it just goes back and forth, and it's exhausting. And so as you start to recognize that, it's to recognize that there's another way. And the reason that anger is a friend, and the reason that it's one of the most valuable emotions we have, is because it can act as a warning light on the dashboard. It's that signal that lets you know you need to slow down the car, you need to look under the hood, because you have a problem. And it's time to look into what it is. And what you'll find with anger management, it's often venting, so people scream into pillows or pound things, or find ways to suppress anger, which is really quite dangerous. But what I'm talking about is not really venting and not covering it up, because you don't want to smash the warning light, and you don't want to cover it up. You want to recognize that it's information. When your car warning light comes on, you know you need to do something with the car. You don't want to smash the light. So it wakes you up. And because it's a cover emotion for those deeper, more vulnerable feelings, those feelings are more authentic. Those are the feelings that are really going on. And they're more connecting. They connect you to yourself, and then you're able to connect with the other person as well. The other thing about anger is sometimes expressing anger, there's kind of this false sense of power. It's like, oh, I'm going to do something. But unfortunately, almost anything you say or do from a place of anger will make things worse. So if you can, rather than use it to come from that place of anger, if you recognize what it's for and recognize that there's vulnerable feelings under it, that it's important to connect with, and that those things, it's telling you there's something really important to you that's being threatened. Okay? So also in front of you, you have a self-empathy flow sheet. And this is just a tool. I'm going to be showing you this tool. Madeleine's going to show you another tool in the next section. But it's something exactly like you were saying, when things happen, when for example, anger is triggered, this is something that you can use. It's a very straightforward, step-by-step tool. It's something that you might not want to use in the moment, but you can kind of say, you know what, time out, I need to take some space. I've got this thing I'm going to do. Or you can just remember and do it later. So this is basically a tool that will help you to get clarity when you're triggered. And you can be triggered to anger, you can be triggered to anxiety. Does everybody understand what I mean when I say triggered? Anybody not clear what I mean by that? So, you know, you're going along and everything seems to be going well, and then all of a sudden, it's not going well. All of a sudden, you're triggered. And so basically, you'll notice the first thing on here are cues that let you know you're triggered. And basically what that is your body will let you know. Like, for instance, when you were talking with your friend, there's physical things that happen, like your body will either tense up or your heart rate will go up, or you'll stop. Either you'll breathe more quickly or you'll stop breathing completely. Sometimes when you're in pain, you're triggered more easily. You have a shorter fuse. Yeah. You can have feelings of anger, of anxiety, of fear, of overwhelm. That can be a cue. And cognitive cues are things like not so much what you think, but how you think. All of a sudden, you're thinking very quickly, more quickly than you could never speak that quickly. Or the other thing is the opposite. You shut down. You go blank. You're going to say something, and all of a sudden, you can't remember what you're going to say. So it's helpful to get clarity about what your cues are. I think all of us have all the cues, but most of us have sort of a fingerprint of certain cues that we have more frequently. And if you can start recognizing sooner, the sooner you recognize your trigger, the sooner you can do something different. So the sooner you don't go down that path that you just mentioned, sometimes we lose friends, sometimes, not so nice things happen. Yep. This is another option. This is, sometimes it can be a split second and you can say, oh, I don't want to keep talking right now. I want to do something different and I'll come back and talk to you about this. And then you have some place to go with that. So I was going to do this process with Connor, but I'm thinking that maybe we should do it with you if you would like to. No, I'm good. Sorry, what was your name again? Dave? So Dave, when this situation happened for you, did you have an awareness, were you aware of your body at all? You said you were in pain, and pain can be, yeah. So pain can be somewhat of a cue. Were you aware of any other body sensations just when you got triggered? What he said was the trigger, but I'm going to ask you if you noticed anything in your body. Did you go sort of tight? And you might not, because you might not be aware yet. Flushed, yeah. You felt hot? No. Did you feel like, was your heart rate going up? Okay. Were you aware of your thinking? Okay, that's okay. So maybe your thoughts might have been going more quickly. But you were aware of anger? You felt anger? Okay. Yeah, and it's yeah, that keeps coming back to coming. And and this is exactly why we're doing. It's like, it would be nice if all your life could just stop and you could just stay with your pain and deal with your pain, and then when that was dealt with, you could go back to your life. But I don't know about most of you, but I've noticed that does not happen. And even though you haven't got a solution for your pain, I think what you'll notice is your life is continuing on anyway. And the things that happen out in your life impact how much you're able to deal with and how much you're able to cope with your pain. And that's what this is for. Does that make sense to you? Yeah. So the observation was a comment. And the reason I put observation here is because I'm going to try to separate the trigger, the event that triggered you from how you're thinking about it. And what's interesting, that even an event, sometimes it's not an event, it's a non-event. In your case, it's something that was said, but sometimes it's something that's not said that you expected to be said. Or sometimes it can be more subtle. It can be a tone of voice. It can be a raised eyebrow. Sometimes when people are, in a close relationship, they can trigger each other like that. I mean, a third person is like, what just happened there? But they trigger each other very quickly, just with very subtle cues. Yeah. Mm-hmm. Yeah. So Dave, what was the actual, what did he said that I've done that story, it doesn't matter anymore, or what did he? Oh yeah, he said it was no big deal. So the actual statement that was said was it was no big deal. That was your trigger. Okay, so that's a thought you have. So the next part, and this is the part. This is the part where, if you can think of a pressure cooker, this is that thing, the valve on a pressure cooker that you can let off steam. So these are all the thoughts that are in there, and this is the way of letting them out. So basically, I mean, thoughts, if you can imagine, thoughts are like steam. Steam will just dissipate and disappear. But if you compress steam, it can run a locomotive. It can blow up a building. So the thoughts, so you said nobody, so it means nobody cares. What other thoughts did you have? Nobody cares.
Because all these people, you know, houses have money.
Mm-hmm.
It seems to be like a big disconnect between people that go to see us and people that are not go therapist. I know that needs
Yeah. So he can afford physio, basically. Yeah.
That was one of my video thoughts. I don't know. I thought it was a big disconnect between the have and have.
Yeah. Haves and the have-nots. Okay. What else were you thinking? And this is where you can run it out. You can turn the page over and just run out all of your thoughts because they're all in there. And sometimes what you'll notice is sometimes the thoughts you're just kind of barely aware of because it's on the interface between conscious and unconscious. Yes, and by definition, unconscious, you're not aware of it, but if you write something down and then you see it and think, oh, really, do I think that? I just kind of barely think it. Yeah. Yeah. Okay, and this looks like a linear process, but we can always go back. So I'm going to stop there, and I'm going to ask all of you now, you have your yellow sheet. If you could take a look at the needs part of the yellow sheet, and what I want to do is guess what needs of Dave do you think were not met in this situation? And Dave, you're sort of the expert. We're going to check with you to see if that's a need that's met or not. So on your sheet there, you're going to see, like you can scan the whole sheet. Does anybody have a guess? What need do you think what need or needs were not met for Dave in this situation? Any guesses? Connectedness? Dave? Mm-hmm. I notice up here you said nobody cares, so a need for care. Mm-hmm. Any other guesses? Empathy? Mm-hmm. Who else has a guess? What's that? Value? Sorry, who's? Yeah, so kind of like consideration, maybe? Okay, you're not valued. Okay, yeah. That just reminded me. Consideration, Dave? Understanding, yeah. Mm-hmm. So clarity? Mm-hmm. Openness? Anybody else? Any other guess? Equality, yeah, okay. Okay, we can always come back. Now, if you could turn the page over to feelings, and we're going to guess. He's already told us anger was a cue, so we can put anger. So what feelings, what other feelings do you think might be happening here? Disappointed? Okay. Fear. Yep. Okay. Frustration? Yep. Are you feeling kind of hopeless? Sort of helpless, hopeless? Okay. Almost despair? Despair? Okay, so the first thing I want you to notice, Dave, a lot of needs not met and a lot of feelings. So what I'm going to ask you now, I'm going to read through what you have, and if you can just pick two that kind of light up, that in this particular situation, these are the loudest for you. In this particular situation. So in terms of needs, it's connectedness, care, empathy, value, consideration, understanding, clarity, openness, and equality. If you would circle two, what would they be? Okay. Okay. And with feelings, you've got anger, disappointed, annoyed, fear, embarrassed, frustration, discouraged, hopeless, and despair. Okay, so you'll notice this statement that's at the bottom of the sheet. It starts with the two words, no wonder. What no wonder does is it gives you space and it gives you permission to feel. Because just as we were saying, so many times our feelings are shut down. Oh, you shouldn't feel that way. Oh, don't feel that way. Oh, it's a trivial thing. You should be beyond that or past that, right? No wonder says, no wonder you feel, of course you feel that way. Any normal person would feel that way. So in your case, Dave, no wonder I feel embarrassed and almost despairing because it's so important to me to have empathy and equality in my life. Does that fit? Yeah. And so you'll notice on the next line, imagine is also written in red. And Einstein tells us that your imagination is actually more powerful than your intellect because it can take you places you've never even been. So if you were to imagine your need for empathy and equality totally met, beyond of wildest dreams, totally, completely met, how would you feel? Mm-hmm. Can you think of an actual feeling? Relieved? Optimistic? Can anybody help him out? If you look at the bottom half of your yellow sheet, do you feel encouraged? Would you feel confident? Invigorated? Mm-hmm. Yeah, it's almost beyond your ability to express how blissful or incredible it would feel. Yeah. So what I'm wanting you to notice, Dave, is you've gone from the statement, the no wonder statement takes you to the depth of how you feel and gives you total space and permission to feel it. And then you go to the other side, where you imagine those needs met, and you feel differently. And the thing about feelings is that if you go to feelings without anchoring it to needs, you can spiral with feelings alone. And so putting feelings with needs is helpful. Okay? I'm noticing we're going over time. So. Yes, absolutely.
Just going to pop in here. I just want, just as I'm listening to this, I just want you to notice how all of these reactions that Dave had probably happened within a split second. But the process that you just saw happen is kind of, it's like a slowing down, like a slow motion, widening the gap between the trigger and the response. And when you look at what happens in that gap, there's a whole lot, like Mary Ellen was saying, that's actually unconscious. So when you go back and see what's in there, we get clarity and really get to the bottom of what our needs are, why we behave or feel the way that we do. So I like to think of it as like slow motion.
Absolutely. Thank you. So I'm just going to keep going here. So you remember we talked about the toolkit, and what I'm going to suggest is this is something, in terms of gathering support, and we often talk about getting support from other people, this is the place to start, to realize that you can actually support yourself. And we often feel like it has to come from outside, that we have to depend on other people, and sometimes when we do depend on other people, we're disappointed. But to know that there's someone in you that can give you deep, profound empathy in every moment. And that's you. So are there any just questions or comments? We're going to take a break and move on here, but any just quick, how was that for you, Dave? Is that helpful?
It's almost therapeutic, actually.
It's supposed to be. Did anyone relate to the process that we went through with Dave? Any comments, or can you imagine yourself being able to do that?
Can you talk about maybe how to apply, maybe we don't have this sheet with us and we're in a situation where someone's feeling triggered, a way to apply that practically should, Dave be in that situation again, or
That's a good question. And what I find, because I work with clients and I ask clients to work with the sheet if they journal a couple times a week, it starts to become automatic and you start thinking that way and it will actually just come into your mind. But the other thing you can do when you notice that you're triggered is just, it's like you note it. You write down, you make a mental note, and you do this afterwards. Because most of the time you do this afterwards to debrief a situation that's already happened. And as you do that more and more, you get closer and closer to the event, to the point where you can actually start doing it in the moment. That's a really good question. Thank you. Okay.
Can I add to that?
Yes.
Just a
yes.
quick add to that. When you start to notice what we're going to go into this right after the break, when you start to notice more and more often what your cues are, and as you slow it down and perhaps over time choose a different response or no response, you start to actually, we're talking about creating new pathways for you, like new ways of behaving, new pathways, new neural pathways in your brain from that trigger response, the reaction, to a response that feels better, more authentic, and more clear for you over time.
Oh, I was authentic.
Yeah.
Okay, thank you.
So I think we'll just get started here. Is that a little bit loud? Is it okay? Okay? Too loud? Good. Oh, thumbs up. Okay. I thought you meant too loud. Okay. Me and audio visual don't always get along so well. All right. So we're just going to dive right into anxiety now. And I just want to point out, like, any of the things that we're talking about, what Mary Ellen just went through and what I'm talking about, anxiety, could be a whole course in itself. So we're really giving you kind of the nuts and bolts in a nutshell. And hopefully from there you might find some tools and also maybe some some resources you might go and find to help you go in more in this direction. So last week we talked about a little bit about how chronic pain occurs physically when pain persists past acute pain, and also about the fight, flight, freeze response that happens in our body as a way to protect us from potential or real or perceived threat or danger. Everybody remember that? Studied it all week, and yeah. So when I talk about anxiety, what comes up? What do you automatically kind of think of? Worry or stress? Both. Worry, stress. How do I eat? How do I pay the bills? So all those like real life worries that cause anxiety and stress in your body. Yeah, absolutely. So anxiety it's a normal emotion. To have that response or that emotion to a real or perceived threat or stress. So we need some anxiety to get us up in the morning, to get us going, to help us meet challenges, to keep us focused, and to basically to get us going. And it can also sometimes be, so don't feel like if you have anxiety, there's always something wrong, because that's just going to compound the anxiety. Sometimes it can be a signal towards a particular action or a feeling. So if it's one thing that you tend to get, if you tend to get anxious about, for example, winter driving. So if you know you have a trip coming up, you feel some anxiety, you know you have to drive, then you're going to be triggered to perhaps put on winter tires to give yourself enough time to get ready in the morning, to make sure you're well fed and well watered. So it can spur us to really take care of ourselves. And it can also, similar to what Mary Ellen was talking about, anxiety, like anger, can be a very protective emotion. And I'll just give you an example of one gentleman that I worked with that had he felt a lot of anxiety in his chest, which is really common to have a tight chest. And when he was able to really notice that anxiety, he realized that it actually underneath the anxiety, there was a whole lot of sadness and grief. So it can be a signpost also towards more softer, vulnerable emotions. So when does regular worry or normal worry become an anxiety issue or an anxiety disorder? Generally when physical or mental symptoms, so cognitive or thinking symptoms, occur more often than not for 6 months or more and become really challenging to control. Okay? So it's almost like it starts to take on a whole life of its own. So anxiety is intense, excessive, and persistent worry and fear, based in fear about the future that we will never know, the future that remains uncertain for all of us, and if we're living in chronic pain, even more uncertain. There's a lot of questions, a lot of unanswered questions. Or it can come on slowly and more insidiously, or it can come on quite quickly with repeated episodes of sudden fear, terror, or panic that reach a peak within minutes, such as a panic attack. And if you've ever experienced a panic attack yourself, you probably know how terrifying that can be when anxiety spikes. And I've had a lot of people that I know that end up going to the emergency ER with chest pain and really, really afraid that they're having a heart attack. But it not always. If you have chest pain, do go to the ER to get it checked out. But but it's been a panic attack, so it really can mimic. It can feel the same. Okay. So when anxiety becomes persistent, just like pain, it can inhibit healing. And it can inhibit healing in a number of ways. One is that anxiety also is rooted in the fight or flight response, similar to chronic pain. So keeping our bodies in a state of tension that restricts our ability to move, to be able to breathe properly, sometimes to be able to eat. And it also can also cause us to avoid. It makes sense to avoid our triggers. So if going out or going to a doctor's appointment or making a phone call creates a lot of anxiety, we can tend to start to avoid those things. And as a result, our lives can become smaller and smaller, not only from the pain, but the anxiety as well. So just going back to a slide we had last week, anxiety is part of the pain cycle. So if you have anxiety and pain can make it hard to sleep. When you're not sleeping properly, you can have less energy. And when you have less energy, you're going to be less active and less mobile. And we know with pain, it's always better to keep moving in some capacity, even if it's just in a small way. So it also gives us, again, different doorways that we can go into to be able to interrupt the pain cycle. And anxiety is just one of them. So this is a sample of chronic pain patients that we have the research study for. Just in one sample, just to show you how really normal it is. So 54%, so about half of people with chronic pain felt some degree of anger. Half felt some depression. And 67% experienced anxiety. So if that is you, you are absolutely not alone. You just said that? So really important that both anxiety and pain trigger this fight, flight, freeze response in your body. And I like to think of it this way. You have the pain as one level. Okay, so one layer, you have the pain and the discomfort that you live with. On top of that, like a second level, is how we react or respond to the pain that we're experiencing. And within that second level is our emotions, our thoughts, and anxiety. And how we relate to that can lessen or increase the pain. But on that second level, that is where we can have some influence. We can influence that level when we feel like we can't do anything about the pain. And as a result, it can affect our pain. So anxiety and chronic pain seem to go hand in hand. The common denominator in both is a reactive central nervous system. One affects the other. Pain affects anxiety, anxiety affects our pain. Is that ringing true for people? Have you noticed that in your own life? Yeah. Okay. So just as in what Mary Ellen was saying, about getting an idea of what your triggers are, what your physical and emotional response is, anxiety shows up in 4 areas. In our thoughts, our feelings, so our emotional body, our body sensations, tight chest, nauseous stomach, and also in our behaviors, which sometimes is avoidance of our triggers or certain areas or certain people, or feeling irritable, angry, snappy. Anxiety, like pain, is also felt in the body. So how do you know that you're anxious? Well, you feel it, usually, in your body. That will give you the signal. So getting familiar with your own fingerprint. And as I said earlier, it's like slowing down. It's like going in slow motion and widening the gap between the trigger, and your response, and finding out within that gap there lies a choice, and that choice is where your freedom lies, to be able to choose a response for yourself that perhaps feels better in the long run. So just like Mary Ellen just did, writing it down can be really, really helpful. You're going to be far more likely to, I think, something like 67% more likely to remember something once you've written it down. So let's get a sense. As I'm talking about worry, anxiety, are you getting any, are you remembering at all, or thinking about what it feels like even maybe right now or at other times in your own body? How does it show up for you? How do you know when you're anxious? You really don't. Okay. So in the exercise that you did with Mary Ellen, did you notice any anxiety? Would you have noticed any anxiety there, or do you go straight to anger? Yeah. Straight to anger. Okay, so yeah, so that was like a direct line. So when you're worried about paying bills, about potential physio clinics closing, or having too much to do, or how am I going to get there? How am I going to get into the doctor? How do you notice that you're worried? What's that? You don't sleep. You don't sleep. You have trouble. Start to have trouble sleeping. Anxiety can be like a number one cause of that. That seems to be the time that the mind starts racing and going over and over things at 3 a.m. when nothing can be solved. Yeah. It's difficult to concentrate. Absolutely. Not thinking clearly. Yeah. It's hard to take in new information because the space is all taken up. Yeah. Okay.
Is it possible that one is always anxious? That you don't need to pick up on it?
That's a good question. It's definitely possible to have a low-grade anxiety a lot of the time. But as you start to pay attention more, you might notice there are periods of time where you don't feel anxious. Okay. Yeah. But I know for people with a generalized anxiety disorder, it seems to be a pretty continuous feeling of dread. When you wake up in the morning, when you go to bed at night, a lot of the time. But even with that, when you pay attention, there are times where it's less, I guess. But yeah, to answer your question. Yeah. So heart racing, sweating, sometimes stomach discomfort, a restlessness, like an edginess, unable to stay still. Some people become very irritable or easily upset because it's very hard to be relaxed and calm when you have a revved up central nervous system, when you feel anxious or worried. Sleep problems, difficulty paying attention or concentrating, and easily fatigued. So you could have sleep problems or just be very or be very tired a lot of the time because anxiety is exhausting. And muscle pain and tension. So tensing around the pain, almost and the reason I'm standing like this is because when I see people that come in that suffer greatly with chronic pain and anxiety are often in protective mode, which is protecting yourself. Muscle pain, tension, headaches. So just like pain, anxiety makes it uncomfortable to be in your body. So this may all sound like a lot of negative, bad news, but I do want to tell you that anxiety itself is very treatable. That second layer. Okay. So we have the body part of it, and as I'm talking, if you're thinking about, if anything comes to you about how you respond, how your body reacts when you're anxious, you might want to jot it down. That there's one worksheet there that you could start filling out today if you wanted to, or take it home with you if you start to realize for yourself how anxiety shows up. And then maybe a little bit trickier, I'm not sure, not for all people, but what are the thoughts that fuel your anxiety? Again, slowing it down. For example, will I be able to work? Could be an unknown. Is this going to get worse? Is it going to get better? It's unknown. What will happen to me? What should I do next? Any other, or is anybody else is familiar with the thoughts that come up for you when you're anxious? When you have an unknown or a fear of future?
I find it's often catastrophizing. It's the worst possible scenario that comes to mind.
Worst case scenario. So that all or nothing or catastrophizing and our brains will do this naturally. Again, I think I may have said last week, if I said 10, if I showed you 10 positive or said 10 positive good things and one negative thing, where would your mind would go to? The negative. Yeah. So our brains tend to go worst case scenario, and it's just a process that we've developed as we've evolved to keep us safe. The flip side is that worst case scenario or the catastrophe rarely, if ever, happens. But we want to think about it in our minds just to make sure. But really notice if you have a tendency towards catastrophizing. Write those thoughts down so you can see them when they come up. Yes.
So I've heard that evolutionarily that the optimists didn't survive, and it's only the people who are basically willing to focus on the possible problems that actually survived and evolved to this point. So it's something that comes very naturally, and something that is just part of our makeup.
It's too bad. Yeah, I know it takes training. We're talking about new neural pathways, and often we have a lifetime of developed neural pathways that we're up against. So I don't know if that was on. Did everybody hear that? The optimists in evolution didn't survive. So we had to be somewhat guarded and pessimistic. But great, in order to stay safe, most of the time now we are safe. But we don't always feel that way. So watch those catastrophizing thoughts. And you can ask yourself, is what I'm worried about within my control? And if it is, perhaps it's a signpost to do something. Okay? Maybe there is something that you do need to do. Maybe there is a phone call to make. Maybe there is a conversation to have. Or maybe it's a conversation to have with a healthcare professional. Maybe it's to get some assistance, right, with anxiety or physio or. So these are just some general ways to take a break from anxiety. The first part is noticing. Take a moment to write out what your particular unique response is. And does anybody have ways they already use? Because if you're here, you already have some strategies. Breathing. You won't read a book on anxiety or chronic pain without a chapter on breathing, I promise you. If there is one out there, bring it to me because I'd like to see it. We're going to talk more about that. The breath is really going to be our go-to for many different reasons. Anything else that you already do? I'll run through a few. So notice your thoughts. Get to know them, not necessarily believe them. We have something like 80,000 thoughts, 60 to 80,000 thoughts that run through our mind every day. Can all of them be true? No. I promise you not all of them are true. The mind generates a lot of thinking. Okay. Notice how, from your brain to your body, how they make you feel. Distraction can be helpful. So simple one-course corrections, change rooms, go outside or do an activity you enjoy. Have you ever got involved in something and actually forgotten, even for a moment, about your anxiety or your pain? And think back, whoa, I don't think I was in pain for that moment. So it's a really healthy thing to do, to give yourself a break. Breathing and or exercise. Keys, movement. Yeah. Movement of some kind. Absolutely. Just going for a walk. Whatever your version is. I was talking to a gentleman earlier that said he decided to walk flights of stairs. And he walked 12 stairs up and down, up and down, up and down, up and down, and paid for it the next day. So he decided he would start with one stair. So when we talk about movement, we'll be talking about that, your version of safe movement. Or call someone. Having a conversation takes us out of ourselves, out of our own experience. Breathe and practice the relaxation response, which was discovered to be the antidote to the fight or flight response. Something that one of my clients keeps is a list of comforting, encouraging, true statements, such as this: I will get through this, I always do. I have support around me. So to remind yourself, when you find your mind catastrophizing, to widen the scope and remind yourself of what is also true, what is true. Because we don't think of it when we're really stressed. Yeah, and being able to just write for yourself what does help you. So 1 degree course correction. Just as I wrap up here, again, we're talking about taking that one step, not the flight of 12 steps. And as you take that one, you're more likely to take the two. So thinking about one course correction over a week, over a month, over a year, what does that look like? So spending just a few minutes intentionally or conscious breathing can trigger the parasympathetic nervous system, which balances and regulates, self-regulates your nervous system when it's in fight or flight, countering the fight or flight response. And this was discovered back in the 70s, I believe, by Harvard physician Dr. Herbert Benson. The breath is the barometer of your stress levels. Barometer or thermometer, is that right? Barometer's good. And can be used to calm and also just to monitor your nervous system in difficult situations. And also we're going to talk about it more when we start talking about learning to move safely again. So you can always check in with yourself. How's my breath? And that will give you an indication of how stressed you're feeling in that moment. So when I started to work more with people who were in pain, pretty much across the board, they weren't breathing for periods of time as we met. The breathing just stopped naturally, not naturally, but because they were in fight or flight, or it was very, very shallow, from probably here to here. So Dr. Andrew Weil has written a number of books on health and wellness, and he says, if I had to limit my advice on healthier living to just one tip, and he's written a lot, it would be simply to learn how to breathe correctly. So if not just for people in pain, but the general population, I would say a large proportion are, in our day and age, with how busy and distracted and triggered we are not breathing properly. So we're going to do it now. You ready? Okay. So I'm going to run you through a practice because I think it's a really important practice to learn how to breathe. And you'll be tired of hearing me say this by the end of this course, but as you start to try it out in your own life, you'll see how it can start making a difference. So right now, wherever you're sitting, if you can, 2 feet on the floor, if it feels comfortable, arms, legs, relax, and just become aware of your breathing right now. Okay? So just notice, without fixing or changing anything, how is my breath right now? So becoming an observer, no judgment. It's not good or bad, right or wrong. It's just the way it is right now. Just notice. And you might notice as you observe it, sometimes it starts to slow down on its own. If not, just start to slow it down. Just to a pace that feels comfortable for you. Okay? So no force, effort, just inviting your breath to just slow down and go a bit deeper. If it helps, just put your hands on your belly or your abdomen, if you can. And as you breathe in, just imagine breathing in through your belly, your abdomen, up through your rib cage, your upper chest, heart, and then exhale. So breathing in, your belly, rib cage, expanding, heart, and exhale. And today, if you're not breathing that deeply, that's totally okay and normal. Okay. So if you've got your hands on your abdomen, just notice as you're breathing if there is a slight rise and fall. And this can require a bit of concentration. So very little movement in your shoulders. And imagine breathing in to expand side to side in your rib cage. So just expanding and exhaling, contracting. Good. So expanding side to side, front to back. And exhaling. So everybody exhale completely. Good. So inhale to 1, 2, and exhale 1, 2. And inhale, expanding, and exhale. Inhale and exhale. Relax your jaw, your eyes, your forehead. Inhale, 1, 2. Exhale, 1, 2. Inhale, side to side, front to back. Very little movement in your shoulders. And exhale, 1, 2, 3. Inhale, 1, 2, pause. Exhale, 1, 2, 3. Relax your arms and legs. Inhale if you can. 1, 2. Relax your shoulders. Exhale. 1, 2, 3. So just relax your body, your hands if they're on your belly, and just take a moment and notice your breathing now. Notice your body. And sometimes people look up and say, boy, I didn't realize I was so tired. or that I was hungry. This is what we just kind of went through. Starting with count 2 in, 2 out. Slowly, what? Okay, good. Okay, we always start really low. Extending your exhale slightly triggers parasympathetic nervous system, just slightly with a pause. So stay there, and for the next week, I would encourage you to practice that morning and night for sure, and in the middle of the day or throughout your day, or even as you're slowly moving. Okay? Increasing it to 5 breaths, 5 counts in, 5 out, is optimal, it seems, for rebalancing our nervous systems. to be able to relax our muscles, to be able to move to a different part of our brain where we can have a bit of a wider scope on our life. But this is really a foundation. All right, I better wrap up here. Holy moly.
No, you're fine.
Okay. Okay, thank you. Are there any questions about that? What that was like?
I found it interesting because when you start breathing like that, I think your posture even improves.
Mm-hmm. Absolutely. Yeah, for a number of reasons. Physically, you're expanding, and also as you feel less threatened, again, as your stress response lessens, you're going to feel less protective. You know that, oh, it's a message to your brain, your body. In this moment, I actually am safe. I think I'm safe right now. Okay? And that's the message that we want to get across. So absolutely, over time, when I've seen people practice, they initially come in, very little eye contact, somehow tend to open up over time. Yeah.
Just like to recommend another book written by Madeleine Eames called Mindful Breathing. So you can talk to her to find out if you want to get a hold of this book. I read it. It's great. Great book.
And it has a section on chronic pain and just some recommendations for different types of breathing, because not what we did today is a great place. And if that's the breathing you do and it works, keep doing it. There are different techniques of breathing you can use as well. Yeah, for pain.
So we're going to give you a 2-minute break, and then when we come back, we're going to ask you, so in the break, maybe if you could think about, again, we're always coming back to our 1-degree course correction. So if you could think about what's one thing that you might imagine that you could do for the next week that could be a 1-degree course correction, and we'll just talk a little bit about that. And I don't know, Francois, if you want to come up and give us some after our 2-minute break. Okay? Thank you.
Thank you.
Righty, excellent, everybody. Is everybody feeling as relaxed as I am now after that boxed breathing? It's really, really relaxing. So yes, so far so good. I think it's been really sort of eye-opening, especially even for myself doing this all the time. It's just great to get the input from some valued colleagues about this, and I think we can all take something away from it. I think that's something I've also discovered over the years is to write things down. There's something about that writing down that triggers your brain into remembering that and putting that into play in your life. So that's a good idea. Write it down, plan. It's always good to sort of just reflect, and do the things we discussed today. So, there's a whole bunch of things I'm actually want one of those forms, because I'm going to sort of, I think that needs to be used more often, and the more you write it down, the more you'll just do it automatically over time. So, is there anything that anybody would like to sort of venture to say that they've learned today? Any new skill that you're excited about trying at home? Anything you didn't know that, excited about hearing about the first time today?
I think for me it'd be kind of the back and forth effect between anxiety and pain, because I was kind of like one generating the other and only going in that one direction instead of like going back and forth.
Mm-hmm.
And therefore I get anxious about it, then that anxiety is causing more pain, and it just keeps adding and adding, and you're basically climbing up like a ladder of that.
Absolutely. Absolutely. Understanding that these emotions also cover for something deeper, but it's great to sort of see that in context. And I want to say that, we sometimes do blocks in the neck. It's called the stellate ganglion block that blocks the sympathetic response. And it's such an important response to block, because that causes, it's not just a airy-fairy sort of concept, out there. It's a real medical thing where your sympathetic nervous system, which is deep here to your spine, it's basically right next to your vertebrae, those nerve fibers get all hyperexcitable, and that can drive chronic pain big time, because you get norepinephrine. That flight or fight hormone in your bloodstream gets secreted, gets increased as a result of that sympathetic overactivity. So the breathing and all these things you talked about, that's just a great way to calm down that response without having to put a big needle in there and blocking those nerves. You can do it at home, which is fantastic. So you can train your own body, just like some of the Buddhist monks, I guess, they do the same thing, where they just train their bodies to sort of just induce that parasympathetic, it's the rest and digest state, as opposed to the fight or flight state. So it's that one needs to sort of swing the balance over, and that really affects your pain in a positive fashion. Alrighty, so good. Any questions, folks? Any questions otherwise? Any final comments from...
So can anybody imagine one thing that they might do differently in the next week? Anybody got any kind of sense of...
Breathing exercise.
Yeah?
Hey, brilliant.
Pretty simple. The sheet that you have, it's a template, but there's a website. If you wanted to start using it, you can actually download this sheet and also both sides of this sheet from that website. So it's something that I have to say, I'm working with clients, it can be very helpful. And especially if it's something that's sort of an ongoing, recurring thing, it's something that you can sort of keep it on file and keep adding to it. And as Francois was saying, writing it down, sometimes it's like, pinning a bug to a board. All of a sudden, you take the power away. So it's a 1 degree course correction. It's gradual, but it can make a difference. So I would suggest that's a possibility of 1 degree course correction. Do you have any?
Just a different time next week.
Oh, yeah. We want to just remind you that our class is starting next week at 2 instead of 1, just to let you know. It'll be a half hour later. So other than that, thank you.
Excellent. If you have any questions, come down, ask me a question. We're here for you. We're really passionate about helping. So if you have any questions, come down and let us know about it. It's been a pleasure having you all here today.
And thank you, Dave, for your participation.
Yeah, very interesting. We need that. It's sort of real life stuff that people learn from. So thanks for that.
And
Perfect.
thanks all of you for coming.